Hello everyone, I'm Anastasia signing in from Nora's. In today's session, we will be dealing with a new topic known as the decubitus ulcer. This decubitus ulcer is also known as the pressure sore and is an ulcerated or slouch area of the tissue subjected to pressure from lying on bed or sitting on a chair for a prolonged period of time. So here when a person is confined to bed or if he or she is sitting in a chair in a same position for a prolonged period of time, then they are at a risk of developing this decubitus ulcer, or we can also say the pressure sore. So what happens here is if a person is in the same position for a prolonged period of time, he or she will be pressuring the same points as we have discussed about the various pressure points in our body. So here, if a person is constantly pressurizing his weight on the same points, then this would lead to a slower circulation of blood and would ultimately end up in the death of tissues. So when this death of tissues occur, this is when the pressure sore or the decubitus ulcer occurs. This is when this decubitus ulcer or the pressure sore develops. So here, this pressure ulcer is a localized ulceration of the skin or the deeper structure. This mainly occurs in those patients who are confined to bed. Friction and shearing forces contribute to the risk factors of developing the ulcer. Not only that, but bladder and bowel incontinence, hypotension, hypoxia, malnutrition, neurological impairment, immobility, as well as altered mental status can also contribute to the factors of developing the ulcer. So here, once a person is at a risk or is developing the formation of this pressure ulcer, immediate treatment and care must be provided in order to prevent the further complication. So here, the main complication include the tissue loss, the infection, as well as sepsis. So in order to prevent this from occurring, it is our responsibility to identify the patients who are at a higher risk, or even to provide treatment for those people who already is developing this ulcer. So what are the causes? Here, there are two causes, which is the direct cause and the indirect cause. The direct cause consists of the pressure, the shear, the friction, immobility, loss of sensation, as well as the combined pathology. So here, if a person is immobile, that is, if he or she is not able to move, if he or she is not able to change his or her position, if there is loss of sensation, if there is the friction and the shear motion, if a person is constantly pressurizing the same pressure points, as well as combined pathology, can lead one to develop this decubitus ulcer. So these are the direct cause, whereas when we talk about the indirect cause, then it includes the mobility problems whereby a person may not be able to move because of his or her disease condition. It also includes the poor nutrition. Here, if a person is not able to consume the adequate amount of nutrition because of his or her disease condition, then this can also indirectly lead one to develop this pressure sore or the decubitus ulcer. The third one is the health conditions. So here if a person is suffering from COPD, if he or she is having any kidney problems or heart problems, then these can also lead one to suffer from this decubitus ulcer. Then also the aging skin, the incontinence. If a person is having urinary or fecal incontinence, then this will keep the body moist, and because of this moisture it can lead one to develop this ulcer. And the last one is their mental health conditions. Here if a person is not in a good state of mind, then this can also indirectly lead them to develop this ulcer, because they will not be able to perform their personal hygiene, they will not be performing their daily activities. So these are the few of the factors that can indirectly cause one to develop this condition. So I hope you have got a clear understanding of both the direct and the indirect causes. So now let us move on to the stages. So here, even when a person starts developing this pressure ulcer, there are various stages that he will go through. Here, if a person has developed the ulcer but he is still in the first stage, then it becomes very easy to cure. But if he or she reaches the last stage, then it becomes a little difficult to cure, as well as constant care, constant treatment, and constant supervision is required. So here when we talk about the first stage, it is the deep tissue injury, which is the new stage. Here what happens is that there will be purple or maroon localized area of intact skin and blood-filled blisters, which usually develops from pressure damage of underlying tissues. So here if you find that there is presence of a purple or a maroon localized area of intact skin or blood-filled blisters, then here we can assume that this person is still in the new stage, and this is caused because of the pressure damage of the underlying tissues. Whereas when you find that the epidermis is intact, when there is presence of discoloration of the skin, when the skin is warm when touched, when there is presence of edema, then we will get to know that it is in the stage 1. Here induration of hardness may also be used as an indicator, particularly on individuals with darker skin. So here on assessing, if you find that there is presence of discoloration in the skin, if the skin is warm and touch, if there is presence of edema as well as induration of hardness, then we will get to know that the person is in the stage 1. And the next is the stage 2. So here if there is a partial thickness skin loss which involves the epidermis or the dermis or even both, then it will fall in the second stage. Here we must also know that this ulcer is only superficial and present clinically as an abrasion or blister. However, in stage 3, we will find that there is a full thickness skin loss involving damage to or necrosis of the subcutaneous tissues. But here it does not only cause damage or necrosis of the subcutaneous tissue, it can still penetrate and extend down. However, in this stage, it does not end just by damaging or causing a necrosis of the subcutaneous tissue. It can further penetrate and extend down. However, it cannot go through the underlying fascia. It is also in this stage that you can find the presence of slouch. So this is about the third stage. When we talk about the fourth stage, then there will be an extensive destruction, there will be a damage to or necrosis of the muscles, of the bones, or any other supporting structures with or without the full thickness skin loss. So here, as we have seen that in the second stage, only the epidermis or the dermis or both can be damaged. In the third stage, as we have seen that it can also damage the subcutaneous tissues and also penetrate and extend downwards until the underlying fascia. Whereas in this fourth stage, this can further damage the bones, the muscles, and even the supporting structures. And the last stage is known as the unstageable. So here what happens is that there will be a full thickness tissue loss in which the actual depth of the ulcer is completely obstructed by slouch in the wound bed. So here what happens in this stage is that there will be a full thickness tissue loss, and also in this stage you will find that the actual depth of the ulcer will be obstructed by a slouch or eschar in the wound bed. So here these are the stages of the decubitus ulcer or the pressure sore. Here we have come to know that there are 6 stages. The first one is the deep tissue injury, then come the first stage, the second stage, the third stage, the fourth stage, and the last one, which is known as the unstageable. So here, depending on the amount, depending on which layer this particular ulcer has penetrated, we will be able to classify the stages of the pressure sore or the decubitus ulcer. So what are the symptoms that we can find in a person developing this condition? Here, as we have discussed, that this ulcer can occur on any parts of the body on which a person will be constantly pressuring themselves on. Here, as we have also discussed, that patients who are always confined to bed, who never performs their activities, as well as who is immobile, are at a higher risk of developing this condition. Here, this usually appears on the bony areas such as the occiput, the hip bone, the tailbone, the spine, the shoulder blades, the elbows, as well as the back of the knee and the heels. So here, if a person is developing this ulcer, then the beginning signs include redness of the skin. Here you will also find that when you are touching that particular area, it is either abnormally warm or cool to touch. There can also be presence of blue or purple tint on the skin, and also while pressing the skin will not turn white, and there will also be presence of pain, itching, as well as a tingling sensation on any part of the body, even if this ulcer is just a minor one. So these are few of the symptoms that you will find a person will be having in their beginning stage. However, as soon as the stages progresses, the symptoms will also differ, and this may include presence of blisters, presence of a broken skin or an open wound. There will be a crater-like appearance, as well as a person will be complaining of a significant pain. So these are the symptoms that a person will be having. Now moving on to the diagnostic evaluation. So as a nurse, how will you be able to diagnose this condition? Here, no testing is usually indicated because this can simply be seen or be known just by observing the skin condition of the patient. However, wound culture can also be done in order to guide the antibiotic therapy when the signs of infection are present. But here, while performing this wound culture, you should also know that this is usually inaccurate because of the bacterial contamination and colonization. So this is how we can diagnose this condition. Now moving on to the therapeutic intervention. Here, as a nurse, what we must do is we must help the patient relieve the pressure. Here, this pressure must be relieved and macerated, and also the presence of the friction and the shear motion must be avoided in order to promote wound healing. Normal saline can also be used for routine cleansing once to several times depending on the condition of the ulcer as well as the amount of wound drainage unless a protective dressing is used. Here, when we talk about wound dressing, then wet or dry dressing can also be used in order to assist with mechanical debridement. And the debridement of the devitalized tissue may also be necessary to be done. Here, while doing this, we can use the scissor and the scalpel following the sterile technique. Protective wound dressing may also be used in order to minimize the disruption of the migrating fibroblasts and the epithelial cells, as well as to provide a moist and a nutrient-rich environment for wound healing. So this is about the therapeutic intervention. Moving on to the pharmacological intervention. Here, we can provide the topical antibiotics in order to treat the signs of local infection. Analgesics can also be provided 20 to 30 minutes before we perform the wound care. Analgesics can also be provided 20 to 30 minutes before performing the wound care. So this is what we can provide to the patient. Now moving on to the next, which is the nursing intervention. So here as a nurse, when we encounter these patients, it is our responsibility to monitor if there is presence of any signs of local infection as well as sepsis. We must also assess the size of pressure sore in response to therapeutic interventions which had been done for that patient. Here, we must also document the larger diameter and not just the surface diameter of the pressure sore, and we must also document the greatest depth because it is only through the depth that we will get an idea in which stage this pressure sore or the decubitus ulcer is in. We must also monitor the pain level of the patient and also their response to pain medication. However, if this treatment is being provided to an unconscious patient or to an unresponsive client, then we must look for presence of agitation, of tachycardia, of increased blood pressure in order to indicate the presence of pain. Look for presence of agitation, of high blood pressure, as well as of tachycardia in order to indicate the presence of pain as well as their response to the pain medication which has been provided for them. We must also provide pressure reducing surface for the patient in order to prevent the development of this ulcer. We must avoid elevating the head end of that patient above 30-degree, because as we do this, there might be a presence of friction and shear motion, and this can interrupt with the wound healing process. We must encourage the patient to perform various activities as well as ambulation as much as possible. We must make sure that we teach the patient to always shift their position every 2 hours. If a patient is not able to perform his daily activities by himself, if he is not able to perform his personal hygiene, then it is our responsibility to do it for them, whereby we can also bathe them in order to make them feel more comfort as well as in order to help them gain their self-esteem. We must also lubricate the skin of the patient, especially the pressure points, twice a day by using a creamer gel. We must employ bladder and bowel program to prevent incontinence. We must also employ the plastic covering and poorly ventilated chair or any mattress surface. We must also ensure that the person is adequately taking or following his diet. We must ensure that he is consuming large amount of nutrition, especially the ones which are high in protein. Here we must also ensure that they are consuming the supplements which are provided to them, and we must also encourage them to take a large amount of fluid. And while we are cleaning the pressure sore, then here it is important that we must do it as directed by the physician or as per the protocol. Here we must also make sure that we go through the physician's order, because here through this manner we will get an idea whether we should clean it by using the normal saline or any other prescribed solution. So these are few of the interventions that we nurses can do. So here, after you have provided care and treatment for the patient, it is also your responsibility to still educate the patient as well as the family members as how they can prevent the development of this ulcer again. Here what we must do is we must first try to identify which patient is at a higher risk or which patient is developing this ulcer. So these are few of the interventions that we nurses can do. However, here it is our responsibility that as soon as a patient comes to the hospital, right, depending on his or her condition, we will be getting an idea, right, whether they are able to move or not, whether they are able to perform their activities or not. So here, in order to prevent the development of this ulcer, we must first identify the patients who are at a higher risk of developing this ulcer. Then we must also perform the daily assessment in order to find out if there is presence of redness, of blister formation, or even of an open wound. We must keep the patient clean and dry. We must also assess the patient to always reposition themselves every 2 hours. We must also keep the client's skin well lubricated in order to prevent cracking by using powders. And if there is presence of damaged skin, then we must also protect that particular area, because here this particular part or this particular skin may be damaged because of the moisture or because of the urinary or fecal incontinence. And if this is not protected, then it can further lead to the development of pressure ulcer, right? So here it is our responsibility that we protect it, and we must also attend to pressure points as often as necessary in order to stimulate a proper circulation. So these are the few things that we nurses can do for the client in order to prevent them from developing this pressure sore or the decubitus ulcer. So now we have come to the end of this session, whereby in today's session we have discussed about the decubitus ulcer. We've come to know that this decubitus ulcer is also known as a pressure sore, and this is mainly common in those patients who are confined to bed, who are immobile, or who are not able to perform the physical activity, who is not taking adequate amount of fluid, of nutrition, as well as for those patients who are constantly pressurizing themselves in the same area of the body. We've also discussed about the various causes, the signs and symptoms which we will be encountering in patients developing this condition. We've also discussed how we can diagnose this condition, what are the therapeutic intervention, the pharmacological intervention, the nursing intervention, as well as the prevention that we can educate or we can do for the patient to prevent the development of this ulcer. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.